One of the most common facial cosmetic procedures is what's known as the facelift, which is probably the basis for cosmetic surgery of the face. And what this deals with is it takes care of the extra sagging skin and very often the very fine wrinkles. The sagging skin that one sees are what we call the jowl areas, and when they become very large, they increase the deep folds that go between the nose and the mouth, and also accentuate what we call the drool lines or the marionette lines that go from the mouth down to the bottom of the chin. And the next area is the fullness in the neck. So when one performs a full facelift, the object is to elevate the gravitational changes of the jowls, reduce the folds, what we call the melolabial folds, or the folds from the nose to the mouth, to reduce the marionette lines, pulling all of the structures both laterally out to the side and upward, and at the same time going into the neck, which might involve liposuction in the neck or tightening the muscles in the neck, pulling this back, giving a nice angle from the chin down to the neck, which we call the cervical, referring to the neck, mental, referring to the chin, a nice cervical mental angle. And that is primarily what we call a full facelift. Now, the structures that are moved, as I mentioned earlier, have to do with the covering of the muscle, which we call the SMAS. And that SMAS is found at the time of the surgery, elevating the soft tissues or the skin off of the face, pulling those up. So a facelift consists of taking care of 3 levels of tissue: the skin, the fatty tissues under the skin, and the covering of the muscle. So all 3 are addressed in a full facelift, whether it be the face that has the most changes or the neck that has the most changes, but all of those changes are affected by elevating the skin, readjusting the fat, and pulling the coverings of the muscle or the SMAS. That is what we call the full facelift.